Hi, my name is Dr. Bhushan, but you can call me Dr. B. In this video, I'd like to discuss a basic checklist to ask your cancer doctor. Once you hear the word C, you become anxious and fearful. And when you see your cancer doctor, you may want to ask questions that will help you to understand what are you dealing with and how best to prepare yourself. So let's start. Number 1, what type of cancer do I have and where has it started from? Now, same body organ has different cell types. For example, origination of cancer from lung is called primary lung cancer, but there are different cell types in lung such as squamous cell, small cell, large cell, adenocarcinoma. And depending on which cell type in lung cancer has started from, it's designated as. For example, squamous cell cancer of the lung or small cell cancer of the lung. Similarly, in breast cancer, there can be a ductal cells, lobular, mucinous cell type. And cancer starting in ductal glands in breast is called ductal carcinoma of the breast. It's important to know the primary cancer origin organ and what cell type it's originating from, as your treatment and prognosis will depend on them. There is a small chance when it's not clear where the primary tumor started from in spite of all the testings, and is referred to as cancer of unknown primary. Number 2, what stage of cancers do I have? Well, staging of cancer is important to know as treatment varies with different stages of the same organ and cell type of cancer, and its prognosis is differed based on that. In general, the early stage have a better chance of cure and survival. Number 3, what treatment and clinical trial options are available locally or outside? Well, it will be important to discuss local expertise available to treat your cancer and if clinical trial is an appropriate option for you. As treatment may require surgical oncologist for surgery, medical oncologist for chemotherapy, and radiation oncologist for radiation. Making sure you have availability of all options locally, regionally, or is travel to the hospital where they may be available. Number 4, what is treatment effectiveness and my chances of cure? And are there any alternative for the treatment? You want to discuss treatment effectiveness, which will tell you your chance of beating this cancer and any alternatives for current treatment available based on your other medical problems, effectiveness of different cancer medicine, and clinical research studies already done on thousands of patients with similar stage and cell types as yours. Number 5, for stage 4 cancer, or sometimes referred as last stage, what is the average duration I can expect with the treatment? Based on your cancer type and other features, your doctor will be able to give a mean estimate of survival in your case. This estimate will give you time to organize your life. But remember, this is only an estimate, as no doctor can give any human how long they have. Number 6, what will be the common side effects of treatment that you have been prescribed and what to do about them? You should get a written information about the name of cancer medicine, their frequency of administration, and total number of treatment, as well as their side effect and what to do if you get any side effects. Number 7, if your doctor open to you about getting a second opinion, After you talk to a doctor about the diagnosis and treatment plan for your cancer, you may want to get another doctor's opinion before you begin treatment. This is known as getting a second opinion. You can do this by asking another specialist to review all the materials related to your case. The doctors who give the second opinion may agree with the treatment plan proposed by your first doctor, or they may suggest changes or another approach. This doesn't require retesting or further procedures, as all information is already available for second opinion. I believe no doctor should ever discourage getting a second opinion. Sometimes you may feel that by asking that question of second opinion, you may offend your doctor. But most of the time, that's not the case. Number 8, please have all your records of lab, path, and radiology test results, as well as cancer treatment given to you either in a paper or a digital form. When you visit your cancer doctor, please take a family member or a friend along with you during your visit and ask them to take notes of the conversation. Don't be afraid to ask questions if it's not clear to you. Finally, let's summarize the checklist. Number 1, what type of cancer do I have and where has it started from? Number 2, what stage of cancer do I have? Number 3, what treatment and clinical trial options are available locally or outside? Treatment effectiveness and my chances of cure. Number 4, what is my chance of recurrence if I take this treatment, and how you would be followed up post-treatment to watch for any sign of cancer coming back. Number 5, for stage 4 cancer, what are the mean survival rate with the treatment that I would take? Number 6, what will be the common side effects of treatment that you have been prescribed and what to do about them? Number 7, if your doctor open to you about getting a second opinion. Number 8, have all your medical records for test results and treatment given in paper or digital form. Well, I hope this basic checklist will help you organize and get some of your questions answered. If you have any questions or comments, please post them in section below. It has been my pleasure sharing this information with you, and I look forward to seeing you again. Exercise regularly, eat healthy, and stay fit. Dr. B signing out.